All right, so tell us your story. What brings you in here?
Okay, so 2 years ago, from 2 years ago, I started feeling a lot of pain. Back pain, my lower back, and both my left and right hip. And the pain goes all the way down to my knees. It's like a sharp pain. And it's been getting worse and worse. And sometimes like I can't sleep, I can't walk. Like when I sit and I stand up, I can't walk. I have to wait like 10-15 seconds and then start walking again.
I see. Does walking makes it worse or does it make it better?
Well, when I start walking, like it gets better. But when I sit again and like take a rest, and then I want to keep like when I stand up and walk again, I can't. It gets difficult for me.
Understood. What else? What have you? I'm sorry. Backtrack a little bit. So you say about sciatica going down both legs. Which one do you notice as worse, right or left?
The left one.
The left was worse,
Yeah.
not the right.
Well, actually, both of them.
Usually one's more worse than the other.
Yeah, the left. The left.
Okay. And you say about it goes to the knees. Where does it usually stop? Does it go above the knee, below the knee?
Below the knee.
Tell me, can you point to me where?
Like right here. Like.
Just below the knee.
Yeah.
Understood. On the front, the outside, the inside, or the back?
The front.
Just the front. Okay, so when the pain goes down, traveling on your legs, where did it travel? On the front of the legs, or the back?
The side. The side.
On the side of the
Yeah.
legs? On both of them?
On both.
Oh, that's interesting. Okay. All right. But never on the back?
No, not on the back.
Understood. Understood. So that's a very interesting, sounds like a fourth lumbar or potential ilium or pelvis alignment. We'll take a look at that one. What have you done so far to help you or try to do with this issue?
Well, I went to my doctor and she referred me she told me to go to therapy. I went there, but it got worse.
In what way did it make it worse?
Well, I exercised there and they put hot pads there, and those it's like sort of like the machine. How do you call that?
But they felt a little electricity?
Yeah, the electricity one.
Okay, so it sounds like a electric stick.
Yeah, and that's all. But it got worse.
What type of exercise they have you do?
The bike.
Worse?
The bike.
The bike?
Yeah.
Okay. So when I hear things like that, such as a bicycle that made things worse, that's a lot of hip involvement, right? Not too much in the low back, but mostly the hip, right? So the fact that it exacerbated, that tells us that we're going to take a little more closer look what's going on in that pelvic region. We're still going to look at the lumbars as well, but that pelvis, there's something going on there. We'll take a closer look.
Okay.
So we're start off instrumentation, and we're just looking for that abnormal temperature. That's given off from inflammation. So when the structure gets damaged, when the byproduct of inflammation is heat. And that's what this device here picks up. Now, I can't use the back of my hand. See over here? It's cool over here, a little warmer, and it's really warm down here. So this over here it can isolate it with far more detail and specificity. Because, see those pro tips? It's only 2 millimeters, and look at the back of my hand, it's pretty wide, right? So that's why we prefer to use this instrument over here. And we found an abnormal temperature reading right at this particular level. So I already can see the swelling is just significant on this case over here. It's just, the whole entire thing is just here. It's not just a small amount, not small amount isolated at all. Okay, that's swollen all the way around. How's that right there?
Yeah, it hurts.
Pain right there, right? So the very top part of the sacroiliac joint. What about this fellow here? Not too much. Not too much. That's what I feel as well. But this side, all the swelling right on the very top part of the sacroiliac joint. So when we talk about either PIR or EX or PIEX, ilium misalignment, potential misalignment over here. All right, let's take a close look here. Close. Give yourself a nice hug. Yeah, see, that's fixated. That's not moving whatsoever. And that left hip is stuck. Let's check the lumbars. How's this fellow right there? Yeah, that's not too happy either. How's this fellow over here? Not too bad. But this one you a little more, right?
Yeah.
That's the fourth lumbar. Not too bad. A little bit here, right? Not too bad. All right. One more thing. Gillet. Stand over here. Would you watch your place like this, please? Just over here, please. Wait, no, hold on. Don't jump the gun there. Out a bit right here. Right. So you can see over here how prominent the swelling is. It's just one huge volleyball we got going on over here. Right there. Go ahead and mark your place. And you don't have proper balance either. Yeah. See, we definitely got an EX misalignment here. Go ahead. So this over here, the excursion, it is moving just fine over here. Right? It's a little fixation here. But when it comes to the EX, right on the PIES over here, it's deviating towards this one laterally, whereas this is going underneath. So we have an EX misalignment over here. It also matches what the history is going on, saying that, okay, she has some pain, getting out of a chair, getting out of a car, and also trouble like walking. Bicycling definitely makes things worse. So we're gonna take a look on the film, see what's going on. We tested and confirmed on you. This left ilium, the hip bone over here, that's a problem on you. There's swelling and edema right over here. And I also see that this joint over here is also a little gapped open as well. Mm-hmm. But what's interesting enough when I see in terms of the overall picture here, when we take a look at the sacrum over here, you see how horizontal it is? Normal, it should be here. It shouldn't be this way up there. It's so flat, it's almost flat as this table over here. Okay, that's very abnormal. So what we're talking about is when your pelvis over here is going like, it's like you're sticking your butt like this. And then that's just forcing your body to arc up like this. Right? So it's putting a lot of pressure right in this region over here. So that also can help explain why this fourth lumbar nerve is also being irritated. And that particular nerve, it's been known to travel down also to not only just a little part of the front, but also the sides as well. Okay, so that may help explain why you don't feel too much pain back of your legs as well. Right? Exactly. So here's the thing. In the Gonstead method, what we've determined is that something this extreme, right? Usually something either PIEX or PIEX type of hip misalignment can cause this, not the other way around. Right? So when I take a look at this one over here as well, that's what I also see. Being that this pelvis over here, it tilted and went this way significantly. That's what we're seeing over here. It's a lot more wider over here and narrow over here. This is also a lot more narrow, a little wider over here. Right? That's also helped duplicate our findings. It went this way. Now here's the interesting strategy to correct your spine over here, because with your spine did over here, most of the time with this particular misalignment, it should go, when it goes EX this way, the rest of the spine, the rest of the entire body should follow along this way. Yours didn't do that. Starting from this fifth lumbar and onwards, even though your hip went this way, it counter-rotated the complete opposite direction. Right? So now, the standard method of correcting this type of misalignment is usually what we call a pull maneuver. We're trying to pull this into proper center alignment. Right? But here's the thing, because the way your lumbars are, because they're already this way, if we pull it, it's going to make it further to the right. Right? It's going to exacerbate that fourth lumbar. You won't like it. So there's a different strategy, especially where we need to correct it. We have to do a push maneuver. So when we correct that, it's also going to pull all the rotated lumbars back into center alignment as well. So in other words, we're dealing with two birds, one stone, right? Let's roll. Right out. Good. This is over here. Ooh. On up. Okay, walk around.
Better.
What's better?
It's like before I was walking like only to like one side. Now I walk like straight.
Alright, that's good progress. What else?
I don't feel that much pain anymore.
Good. You mentioned about just going to the sides. How's that now?
No, I don't have pain actually. Thank you.
Oh, you're very welcome.
Thank you so much.
Okay, so there's one homework you do gotta do. Actually, that's not correct. There's two. So for your left hip over here, I want you to ice this because as we show to the viewers as well, right? You can see in the videos as well. Okay, the swelling is this huge, right? All that heat, it made it worse, right? Heat is a funny thing about it. If we're talking about a chronic condition and we want to increase more inflammation to accelerate the healing process, okay, then we put heat onto it, right? But there's a strategy to it. After a couple minutes of heat, you're supposed to put cold right afterwards to pump all that extra fluid out of the way.
Okay.
The fact that they only put just heat on it, they just simply just increase and exacerbate it so much more. So we're gonna change the strategy with this one. I want you to put only just cold.
Only
Right?
cold.
Because this is so acute right now. Right? So heat is not the right strategy for this one. I want you to put just ice on this 20 minutes, 3 times a day. The second thing I need you to do is this. And as I'm gonna show to the viewers over here, you're wearing heels. All right, see how high that heel is? Looks like about 1.5 inches, right? 2 inches heel, what have you, right? The problem with those heels, because your hips and pelvis do it like this, right? And here's the thing, if I don't have anything to bounce myself off, I'm gonna fall forward, right? So how does your body biomechanically adapt to these high heels? Okay. What it start doing is it's gonna start rotating, tilting your pelvis. Your pelvis is already tilted as it is, right? We don't want to make it worse. So in the meantime, while that pelvis, the foundation is healing, you have to stop wearing heels.
Okay.
I understand you definitely want to try to wear heels, okay? In this case, no. It's strongly advised not to. I recommend trying to wear sneakers as much as possible. It usually takes about 2 or 4 weeks, right, for that pelvis to heal nice and strong and very well because of how acute the swelling is right now. Right? Get all the swelling out of the way, wear the sneakers, and you'll be fine, good to go.
Okay, thank you so much.
You're very welcome.
Thank you.